move on to the second topic, which is sort of talking around managing the rehab process and how that looks. So sort of starting the rehab process, where the starting point is, how that sort of fits together and how you progress and that type of thing. So the first sort of question really is, how do you determine the starting point of your rehab program, which we have mentioned previously a little bit, and sort of what kind of things do you use to determine that? So I'll start with Mike on this one. So how do you start? How do you get your starting point?
I tend to just start with a kind of a needs analysis. So if I know the activity, then it's a little bit simpler. But I want to know what they need to be able to do and the loads that they need to be able to tolerate and all that kind of stuff, and the tactical type stuff as well. And then just look at, the gap between the two. So where are they at now? So if it's an ACL, you know that they're not going to be able to play basketball, so to speak. But at the same time, you know that there's going to be a considerable gap between where they're at when they're up to the ACL and where you want to get them back to, say, as a point guard. But obviously, if it's something less significant, then I know that it's not far away, and I can actually, do a little bit more with them, so to speak. And I just kind of backfill. I literally backfill from where they need to be in their sport, their activity, their life, or if they're a military operative, what they're going to do in the arena, the field, or whatever. And then say, okay, well, these might be the steps. This is where you're at now. This is what we're going to do. And if they can do it, it's kind of like, okay, let's crack on. Because sometimes, like in the past, I've gone, right, we're going to do this, this, and this. And maybe 2 out of the 3 things they're able to do. And I'm like, well, okay, let's move on. And I don't kind of, wait around. I just kind of push them along that process and just take them from there.
Okay. Is there any specific kind of sort of tests or functional tests or anything like that you might use to sort of help you determine your start point?
Yes.
Or do you just sort of do it depending on the person that's in front of you?
Yeah, all depends. I mean, I'll use, range of motion tests. I'll use, a single leg squat or a single leg landing if it's safe to do so, obviously. Obviously, if it's a ligament rupture or a ligament tear, there'll be some orthopedic tests and stuff like that. It all depends on what point I kind of meet them in the process. Because sometimes now, more often than not, whether it's been at rugby or basketball, it'll be, I've had this problem for a while. I've seen this person. Have you got any ideas? Unless I'm unfortunate to be courtside or pitch side while they do it, it tends to be a little bit more like that as well. And then I just kind of hash it out with the person. I mean, during COVID, I've had a few people contact me, and you kind of do this, a little bit of a kind of a FaceTime or Microsoft Teams type consultation, and it's a lot of question and answer type stuff. Can you do this? Yes. Can you do that? No. Okay. And you just establish what they then can do, and then just start progressing them through from there.
Okay, cool. Evie?
Yeah, similar to Mike. So considering the needs analysis and the end goal, and then kind of assessment wise, it'd be obviously a mixture of clinical tests, like fundamental movements, and then field-based tests if they're up to that, if they can tolerate anything like that. So I tend to, with my assessment, gradually progress the sort of stress that I'm putting them under with the assessment until I get to the point where they fail in different aspects, and then start from there. And that test as such that they fail on might be a good starting point for the rehab program.
Yeah. Okay.
I agree.
Brilliant. Lee?
I think the big thing, and it doesn't matter whether you're with elite sport or in private practice, is ask good questions. So I was really lucky. I got to go to the Rio Games. I was HQ for Team GB. So I got nominated to be with a load of sports like table tennis, fencing, weightlifting, taekwondo, mountain bike, BMX, stuff like this. Stuff I knew absolutely sod all about. And you could have very easily gone into that. Look at me, big kahunas here. I'm Team GB physio. I'm superstar. But you don't. You go to the coach, you go to the athlete, and you go, what is going on here? And just talk me through it like I'm an idiot, because I am. And actually, they like that. And then you need to follow up with good questions. You can't keep playing the idiot. You can play the idiot once, and then you've got to ask good questions, or they soon lose interest in you. But the example would be, so I went into table tennis, and they get loads and loads of their side they hold the bat on hip problems. And I was watching it going, oh yeah, got this. I know why they get hip problems. I'm a bloody genius. It's because they internally rotate the hip and constantly impinge it when they're playing shots. Oh, simple. I'll just strengthen their glutes and stop them internally rotating. Piece of cake. Yeah, genius. Sat with the coach for a few minutes and realized, no, that's how they transfer force. And if you actually block that ability to internally rotate, you'd bugger up their shot. So yeah, you'd stop hip problems, but you'd stop them winning anything. So mission accomplished, no pain. Excellent. So it's about asking good questions. And also, like Evie said, you don't always have the time or the luxury to be able to go through a process of elimination, starting at the very easiest exercises and working through. So sometimes you just got to go, what do you think you can do? You need to do this, a layup in basketball. At the moment, what do you feel confident to do? And then break that down into, okay, they feel they can run, but they don't feel they can jump. Right, so I'll get them to do X, Y, and Z, which relates to what they feel they can do, and maybe I'll just nudge it on. So sometimes we buy into this classic, yes, you've got to do your orthopedic test, you've got to clear the joints, you've got to clear the ligaments. That's taken as read. But then the good stuff starts with then what do you do after you've asked a good question?
Yeah. Okay. So I think there's probably a bit of a mixture between both subjective and objective sort of assessments there, isn't there? In terms of, I think, just thinking if I was a student now, sort of how I would be looking at it, and sort of I think a couple of the key things are from a subjective test or subjective assessment. Sorry, you should be talking about or looking at, what are your aggravating and easing factors maybe. So what aggravates you, so that you can potentially either avoid that or understand that's something you need to build in towards, and what actually eases your pain. So the things that are helping them, so you can potentially use those as a starting point to build on and build into those aggravating factors maybe. And maybe even one of the things I've thought about was the sort of sin factors. So think about severity, irritability, and sort of the nature of the pain. So, how severe is it? How irritable is it? If it's really irritable, I'm not going to suddenly start throwing an hour's worth of rehab at them, and trying to just sort of keep a relatively basic idea of, okay, well, if after 5 minutes it's hurting, then we're gonna have to be careful how much we do and how much we load into that particular, whether it's direction or particular sort of aggravating factor maybe, and just building on that.
The other is sequencing that assessment. If you sort of know what is the most aggravating, then the temptation is, if you want to bias your assessment, you do that first and go, whoa, that's positive. But then everything else after that is positive, and you get incredibly confused. So having your head, I'm expecting this to be the most positive thing they can do. So I'm going to do all the Billy Basic stuff behind that, which I'm expecting to be negative, but make it clear to the patient, I'm doing all these clearing tests first. It's highly likely they're going to be negative. Don't worry. Because you know what patients are like. You sat there with a patient and they're going, oh, you haven't found anything yet. Oh, my God. And it's like, no, this stuff's all supposed to be negative.
Yeah.
I just need to go through these. I joke, quite often I'll go, yeah, it's standard. I've got to assess your knee. I've got to test all your ligaments. I don't think it is, but I've got to do it or I don't get my badge.
Yeah.
So, I think sometimes as well. Oh, sorry, Alan.
No, go on, Evie.
I think sometimes as well, if it's not very irritable, then you might not find anything clinically or in the treatment room at all. And again, going back to what Lee said, they might be thinking, I swear, like there is a pain, but it's just not being provoked. So don't be afraid. If they pass everything, no problems in the treatment room, don't be afraid to get them out in the field or the relevant environment and do some more some more loaded tests.
Yeah, we had that with one of our players. He had a groin issue, passed everything, and he was number 7. I was like, well, you need to get up off the floor occasionally because you're gonna get tackled. You're gonna be rucks and mauls and whatnot. Said, can you just do a Turkish get up or something like that? Just lie on the floor, get up for me. He went to get up and he was in bits, couldn't move. I was like, right, you're not playing. And I think that's the other thing as well, is that although we have to do the orthopedic tests, going back to what we said earlier about it, we don't necessarily have to rely on them. We also need to, watch that individual and, like Lee said, ask questions and understand the sport as well. When I went into rugby years ago, I didn't have a clue about it whatsoever. So I spent ages watching the training sessions, talking with the captain, talking with Jeff, the coach. just trying to understand it. And I started watching the Six Nations more actively than just having it on in the background as well. So that, again, it just gave me that understanding of what players go through and what their body, you know, what we need to put their bodies through as well.
Yeah, the red button on the BBC is really good on BBC Sport. I must watch. We don't watch like normal run-of-the-mill sports in our house. We'll watch every obscure sport. I'm thinking that one, like Mike, I was lucky enough to have to deal with some special forces soldiers, and invariably we'd have a conversation on the phone, which would go, "When do you get your pay?" "Oh, when I've tabbed out about 20k." So, and I'd be like,
Yes.
"Right, I'll see you about 6 o'clock. Can you run 10k before you arrive? Because there's absolutely no point me having to look at you until you at least irritated those tissues a little bit."
Yeah.
And sometimes it is that conversation and expectation, especially if you're lucky enough to work with a gym, and you know the pain occurs after, and you've had that conversation. Then put them towards that situation, because again, let's say it's a runner. What you might see is you watch them for the first couple of minutes running on the treadmill, and then 10 minutes later, their running gait's totally different. And you've got the really Billy obvious solution to the problem. And technology helps now, because you can just get somebody to video them.
Yeah.
You know, can you get your mate just to video you 10 minutes into your run, 10 minutes into your cycle, and let's just have a look at what you're doing?
Yeah, I think that's important, isn't it? Recognizing that sometimes you're not just going to see things there and then. You're going to have to sort of move away from the bed and do things. So that's where maybe some of the functional testing sort of comes in a little bit more, where you might, although it's not taking them sort of into fatigue or into the specific sport, you might just get them off the bed doing squats, single leg squats, you know, maybe even hops and things like that, to try and challenge them a little bit more, to try and find out a little bit more about how they move more dynamically.
And we probably do have to plug the research we've done at Salford in this, and Alan's been part of it, is we did research on single leg squats and found that single leg squats reflects how you land, and to a degree reflects how you run in a straight line. So if you're god awful at a single leg squat, you are going to be god awful at landing and running. So, but if you're good at single leg squat, that doesn't mean you're going to be good at landing and running. But it sort of gives you a layer of indication of movement. You know, that's there, and it's magnitudes of load, and you need to be comfortable with having a loading paradigm.
Yeah, and I think also using those screening tests as such when they're fatigued, and seeing if there's a difference between sort of somebody who's fresh versus somebody who's fatigued. Because like you say, if they've run 10k, their gait may be completely different at the end of that 10k compared to at the start, which then puts a lot of stress on different tissues that might be causing issues.
And what's also interesting, if we go back to the cognitive stuff, and this is pretty state of the art, people like Greg Meyer are into this now, and Dustin Grooms and stuff from the States, is give them a cognitive task when they are single leg squatting. Get them to, you know, scan for something. You know, what's the picture on the wall over to your right? What's that showing? Or, you know, the stuff none of our athletes can do, which is count backwards from 87 in blocks of 4.
Yeah, I tried that with the military and it worked.
Yeah, it don't work. But if you sat listening to this, just try it. Stand up and single leg squat for a few reps, and then try and do it while you're counting backwards in blocks. And you'll find you'll go wobbly. And it's sort of showing you, well, we might have even fatigued them and they're all right, but actually we need to fatigue them and give them some mental stress. Which is very much where high-level athletes get injured. It's when their brain's exploding, not so much their body.
Yeah.
Well, they do that part of selection, don't they? They'll go do some kind of physical beasting, and then on the way back into camp, they'll say, right, you know, what was the registration number on the red car just by the gate? And you know, some guys might actually fail the task, and that's the point of the task. But a lot of them will think it's the physical. So we do need to consider that, and again, it's something that we don't really think about. One of my big bugbears as well is not to slate S&C, but for me there's too much of a focus on strength and not on the C, and really conditioning is not a great word. I think capacity is a better word. It just doesn't sound cool, but the capacity to replicate movements, you know, well and fluently and tolerate lows is really important.
And it's also moving them from that closed skill, just doing a squat, doing a landing, to something which is real. If we go back to our little old lady again, she's not just walking around the Trafford Centre, she's looking at stuff, She's having to avoid people. She's having to decision make all the time, probably try and remember shopping and which shop she wanted to go into.
Yeah.
And so we're only, if we're going to get to, how we look at progression, but the progression is for any given exercise, have we also stressed them cognitively and capacity wise, as Mike said. So yeah, they can squat, but can they squat when we're stressing the head out a little bit? Can they squat when they're a bit more Billy Bollocks?
Even if you just add something, a little bit of complexity, like to replicate scanning, because we know that scanning has an impact on the kinematics of the rest of the movement in the lower limb. So even if you just add something in, like asking them to move their head while they're doing a single leg squat, that might be enough to provoke the pain or cause them to fail as such.
Yeah, definitely. So I think just sort of putting a bit of a summary into that, it's kind of, obviously it's dependent on what you've got in front of you, but if you you can use your clinical tests sometimes to sort of help you understand. So if they're getting pain on an isometric leg extension, then you're not suddenly going to start going and throwing them on a 100k leg extension sort of exercise. You might think about your isometrics, things like that, and then building up from there. But using that, all the information that you get from them, both subjectively and objectively, to try and help you determine where your starting point is. I think that's the not so simple sort of way to look at it, isn't it, really?
And there's probably the final bit on that is probably putting then, if not, why not? So if someone is managing, a max resisted isometric, but you stand them up and they're struggling to lower themselves into the chair on one leg, well, you're like, a max isometric is probably generating more force through that tissue than that lower. So why don't those two match up? So you also have to go, hang on, that, so why not that?
Yeah.
Or I've watched them walk in perfectly, but now they're struggling to single leg squat. It's like, well, that doesn't quite compute. Yeah. So it's then trying to understand the why, and that might be actually they're just afraid of the movement or they're fearful, and then actually what's going on there? Are you actually in pain or are you just a bit scared?
So it's bringing that psychology element back into it again, isn't it?
Like asking good questions.
Yeah.
Ask good questions.
Yeah, and just find out a bit more about everything and why and what they're feeling, I guess, in that respect.